Hello, I'm Sofia Zapata, and today's assignment is vital signs. So let's get to it. I feel like I'm pretty confident about doing vital signs now because I've been doing so many videos of them. So let's get to it. Sorry, there's kind of bugs in here, but anyway, so first you want to check you have the correct patient, but you want to wash your hands and also sanitize them too. You're going to go inside the examination room, and you are going to introduce yourself like, hello, hi, my name is Sofia Zapata. I am your medical assistant, and I will be obtaining your vital signs today. Can I verify your name and date of birth, miss? Or if it's a mister, you would go ahead and verify them by asking them their name and date of birth. After you have done that, you are going to do their weight and also their height. Then you are going to do their temperature, their heart rate, their pulse, and also their blood pressure. Let's go ahead and do the blood pressure because I have it on everything. I am going to be the patient for today. I have my watch here. I am prepared. I wish I had gloves with me. I would put them on. I'm going to put on my gloves. Wait, do I put my gloves on in the vital signs? I could, right? I mean, it doesn't harm to wear gloves, but anyway, I need to go back and check on my book. Okay, but let's keep going. So I'm gonna do my blood pressure right now. So I would tell her, ma'am, we're going to start by doing your blood pressure. And if I can just take it, is that okay? And the patient would say yes, or either give me a hard time, but that's what we're here for. So let's do this. So this is my stethoscope, and this is my blood pressure cuff. This is the valve, and this is I forgot this one, but so I want to make sure that this is on. It turns off and it turns on. Right. There you go. Now it's turned on. And we're going to take the blood pressure like this, not with the thumb, or else you might hear your heartbeat, and that's not what you want to get. You want to get the patient's blood pressure reading. So I'm going to secure the valve, right? And I'm going to pump this to 160. So let's do it. Okay, then I'm going to slowly get the reading and switch the valve to the left. And slowly, I'm going to listen to the reading. Okay, so I'm back. This was a little messed up, but now I can hear my heartbeat. So let's go ahead and do this again. Pump this up to 160. Then I'm slowly going to release this. I'm going to listen to it. So I got 98 over 72. I kind of want to keep doing my blood pressure, but it is a homework, so I cannot do more than one reading, but I will continue to do more after this video. So let's get on with my respiration and my pulse. I still kind of have a hard time trying to do both at the same time, so I am going to attempt to do that right now. So now that I've done the blood pressure reading, I'm going to go ahead and do the patient's heart rate and also their pulse. I'm going to start doing the patient's heart rate. You want to make sure you tell them, okay, I'm going to do your heart rate and your pulse. Or you could just tell them you're going to do their pulse. That way they're not going to start breathing fast or, stop breathing or any type of weird breathing. So I'm going to try to do my heart rate and then the pulse, and then they'll be done and they won't even know that I did both. So let's start doing the heart rate. For 30 seconds, I'm going to be doing the heart and the pulse for 30 seconds. Okay, now that I've done the patient's heart rate, my heart rate, I got 9 beats for 30 seconds, and I'm going to times that times 2. So the actual heart rate reading is 20 beats per minute. So I tried doing the pulse after the other 30 seconds, but my fingers kind of went numb and I stopped hearing my pulse. So let's go ahead and do that right now. Let's wait for there you go. So for this pulse, I got 40 in 30 seconds. I will times that times 2. So 40 times 2 is 80. So that is your final reading for the patient's pulse. And last but not least, you also want to get their temperature, depending on if it's an infant or an adult. An infant, you would take their temperature here, temporal artery. Or you can do that for an adult too. For an adult, you can do a thermometer, disposable thermometer, or a machine that they will provide to you at the clinic. You're done doing all the readings. You document that in their patient's health record. You also document everything else along with chief complaints if you are doing them that exact day. After that, you tell the patient the doctor will be with you right away. Do you have any other questions? Is there help? Anything you need help with? You make sure that they feel comfortable and they feel like they are welcomed. So if they have no question, or if they do, you answer their questions. If you can't, you let them know that the doctor will, and that the doctor will be there shortly. And that's it for this video. Thank you very much.